What is a blighted ovum pregnancy? Do you know what a blighted ovum pregnancy is? Welcome to another episode of Omegy. In today's video, we will be talking about what a blighted ovum pregnancy is. A blighted ovum pregnancy, also known as an anembryonic pregnancy, happens when a fertilized egg implants in the uterus but fails to develop into an embryo. It is a type of early pregnancy loss that can be emotionally difficult for people who want to conceive and have a healthy pregnancy. In this article, we'll go over the specifics of a blighted ovum pregnancy, such as its causes, symptoms, diagnosis, and treatment. A fertilized egg travels via the fallopian tubes and inserts itself into the uterine lining when a woman becomes pregnant. In a typical pregnancy, the fertilized egg grows into an embryo, which ultimately develops into a fetus. A blighted ovum, on the other hand, develops the gestational sac but does not form or stops developing extremely early. As a result, the pregnancy sac is either empty or only has a little, underdeveloped structure. What are its causes? The causes of a blighted ovum pregnancy are unknown, but they are frequently linked to chromosomal abnormalities or genetic factors. These abnormalities can occur at any time during the fertilized egg's development or during early embryonic development. They can cause the embryo to fail to develop or progress past the early stages. In a blighted ovum pregnancy, chromosomal abnormalities most commonly involve errors in the number or structure of chromosomes. These abnormalities can prevent the embryo from properly developing, resulting in the absence of a visible embryo within the gestational sac. It is important to note that these chromosomal abnormalities typically occur sporadically and are not usually influenced by the parent's actions or behaviors. They are frequently a result of chance and are not indicative of any underlying fertility issues or genetic problems with the parents. While the exact cause of a blighted ovum pregnancy is unknown, certain risk factors may increase its likelihood. Advanced maternal age, or over 35 years, a history of previous miscarriages, certain medical conditions such as polycystic ovary syndrome or PCOS, or thyroid disorders, and exposure to environmental factors such as smoking or certain medications are all risk factors. What are the symptoms? Women who have a blighted ovum pregnancy may initially experience typical early pregnancy symptoms such as a missed period, a positive pregnancy test, breast tenderness, and mild nausea. In response to the implantation of the fertilized egg, the body begins to produce pregnancy hormones, including human chorionic gonadotropin, HCG. Even if embryonic development does not progress as expected, these hormone levels can rise and mimic a healthy pregnancy. However, as the pregnancy progresses, signs of miscarriage may emerge. Vaginal bleeding, which often resembles a heavy period and is accompanied by cramping and tissue passing, is a common sign of a blighted ovum. Individuals may experience emotional and physical distress as a result of the bleeding and tissue passing, and it is critical to consult with a healthcare provider for an accurate diagnosis and appropriate medical guidance. It's important to note that not all cases of early pregnancy vaginal bleeding and cramping result in a blighted ovum. Other factors, such as implantation bleeding or subchorionic hemorrhage, can cause these symptoms in some cases. As a result, a thorough medical examination is required to determine the underlying cause and provide appropriate care. Diagnosis. 1. Ultrasound. An ultrasound examination is usually used to confirm the diagnosis of a blighted ovum. The healthcare professional will visualize the uterus during the ultrasound to determine the presence of a gestational sac. The sac appears empty or may contain a small, underdeveloped structure known as a yolk sac in a blighted ovum pregnancy. A blighted ovum is confirmed by the absence of a visible embryo within the gestational sac. 2. Blood tests. Human chorionic gonadotropin or HCG levels, which are typically lower than expected in a blighted ovum pregnancy, may be measured using blood tests. HCG is a hormone produced by the developing embryo that is typically present in higher concentrations during a normal pregnancy. However, in a blighted ovum pregnancy, HCG levels may be lower than expected or rise more slowly than expected. Blood tests, particularly those used to monitor HCG levels, can help in the diagnosis and management of a blighted ovum pregnancy. Healthcare professionals can gather valuable information about the progress of the pregnancy and determine if it is developing as expected by tracking the levels of HCG over time. During the early stages of a normal pregnancy, HCG levels usually double every 48 to 72 hours. In a blighted ovum pregnancy, however, the rise in HCG may be slower or even plateau. Low or declining HCG levels may indicate that the pregnancy is not viable. To observe the trend in hormone levels, blood tests for HCG can be performed multiple times, typically a few days apart. A blighted ovum is confirmed by a lack of significant increase in HCG or declining levels, as well as an empty gestational sac on ultrasound. It is important to note that blood tests alone cannot determine the presence of a blighted ovum. The primary diagnostic tool remains ultrasound examination, which provides direct visualization of the gestational sac and the absence of an embryo. However, blood tests, particularly HCG monitoring, supplement ultrasound findings and assist healthcare professionals in making a more accurate pregnancy assessment. Receiving a blighted ovum diagnosis can be emotionally upsetting for women who were looking forward to their pregnancy. During this difficult time, it is critical to seek emotional support and guidance from healthcare professionals, family, and friends. They can give you the information, counseling, and support you need to cope with your loss and discuss your future reproductive options. Blighted ovum pregnancy usually results in a spontaneous miscarriage. When the body realizes that the pregnancy is no longer viable, the uterus begins the process of expelling the empty gestational sac. Individuals may experience heavy bleeding, cramping, and tissue passing during this process, which can be emotionally and physically taxing. Consultation with a healthcare provider is essential to ensure that the miscarriage proceeds safely and that any necessary medical intervention is provided. A healthcare professional may recommend medical or surgical management of a miscarriage in some cases. This can include using medication to help the miscarriage finish or performing a minor surgical procedure, such as a dilation and curettage, to remove the remaining tissue from the uterus. The most appropriate management approach is determined by factors such as the individual's overall health, the progression of the miscarriage, and personal preferences. Individuals and couples may experience a range of emotions after a blighted ovum pregnancy and subsequent miscarriage, including grief, sadness, anger, and confusion. Allowing oneself to grieve and seeking support from loved ones or support groups is critical. Many people find solace in talking about their experiences with others who have been in similar situations. Additionally, healthcare providers may provide emotional support resources such as counseling or therapy. And that is what a blighted ovum pregnancy is. Do you have any questions? Feel free to write them down in the comment section below. Please like and subscribe. Once again, this is Amaji. Thank you for watching and we will see you in the next video.